Hi, class. We have a special guest speaker here with us today that is going to talk with us about addictions. And so I will have him introduce himself.
Hi, everyone. Happy pandemic. Hope you're all staying safe. My name is Ajay. Pronouns I use are he or they. And I'm a second year graduate student in the marriage and family therapy program. I also I specialize working in like human sexuality and lots of areas of like power, privilege, and difference and couples work. So, thanks
Great.
for having me today, Candice.
Yeah, absolutely. I really appreciate you being here. And so first question is about just in general, what would you say are some of the biggest contributors to addiction? You know, in light of COVID-19 and stay-at-home orders, that places some limitations on people living with different types of addiction. And so what would you say are some of those biggest significant contributors?
Yeah, it's a good big question, and I would say, like you said, in light of COVID-19, I think addictions in general is if we're looking at it from a model of them being like a disease, not that we want to stigmatize, binging a whole series of shows on Netflix or anything like that, and certainly not right now. But regardless of what it is, just realizing that addictions in general are like a disease of isolation. And so I think when we have those situations where people who already tend to kind of isolate and go inwards and fall into depressions and whatnot and have these outlets, there's less of a chance for like human connection. And whether we are talking like substance use, alcohol, or other behavioral things as well. I think they all would fit into that boat of just could potentially being amplified because of COVID and because of the lack of resources for connection or the lessening. Obviously, we've got internet connections like we're doing right now, like Zoom meetings. So there is definitely things people can do.
Yeah, thank you. Speaking of some of the ramifications of different types of addiction, so you mentioned, binge watching episodes on Netflix and the importance of that not being stigmatized, especially right now. But addictions are treated differently, and we talk about in this class that not all addictions are substance and alcohol or drug based. There's different types of behavioral addictions as well, whether it's over exercise or gambling. And so could you talk to us a little bit about your insight around how different addictions are kind of treated differently, both from a stigma point of view and also a legal standpoint?
Yeah, it's probably one of my favorite questions around addiction because it's a really easy way to see how we do categorize and differentiate it. And like before even answering this, just realizing that when addictions do cause harm to other people, other populations, the results of that should always be, the victim with the victim in mind, where the care that they need and the person who's the perpetrator would be responsible. So this isn't to like take away from any of that. But like one example is like if a person's addicted to like eating chocolate chip ice cream versus if we put them in the category of one of the worst things we can think of in body, like pedophilia, just those two things are obviously clearly different categories and they should be. And at the same time, like at the root of like addictions, they're coming from the same kind of like anxious, hyper focused place of needing like release or relief, all of that. And what you said is true too. I mean, we categorize and certain things we celebrate. Like we were going to celebrate to some extent someone that is like more in doing like exercise, like it's wow, that person's really fit or something like that, and that's great. People can strive to do that, and I don't want to take away from that either. But just if we look at the difference of how we view these things, I guess anything really be an addiction in that sense.
Yeah.
Does that kind of make sense?
Thank you. That makes sense. Yeah. And, as a family therapist trainee yourself, you have a different angle in that you can see kind of like the family system impact of addiction too, and how that can look different with different members of the family. So I was curious if you could speak to us a little bit about how you see addictions impacting the family system.
Yeah. Well, the way I see it, as a family therapist is that you got a family member that's addicted to heroin, cocaine, some substance, or even like gambling or sleeping with sex workers, whatever the thing is, that's like, it's going to be actually like a symptom of the health of the whole family unit, you know? So, and a lot of times that's what it is. And it's like, you see this with pressure, and the pressure has to come out somewhere. And a lot of times the thing I notice, like both in like my clinical work that I've observed so far in my career, is like, that is a lot of times what happens, where it'll get kind of hyper focused on that individual and the family when we're not seeing what's happening around them to cause that in the environment. And it's not to say that the person who's doing that doesn't hold a responsibility too, but it's just, you know, a lot of times the energy is so hyper focused on that, when in fact it should be like a mirror where everyone reflects on what are things they're bringing into the health of the family unit. What are ways that maybe more acceptably so they're doing it? Maybe that's hyper control. They're being very controlling or demanding or whatever the things may be. And I think with family units too, and intergenerational things, we also look at like intergenerational trauma. I think we look at big and little T trauma, you know, whether it's like assault or attachment wounds, and like how these things kind of show up to affect people's lives, where they may or may not be able to like express themselves, and there may be these patterns that are just like really set in place, where they're looking for that relief.
You used a really key term when you mentioned trauma just now. You said big T and little t trauma, and I'm thinking that some students may have some questions about what that means. Would you mind just
Yeah.
stating, you know, what that, how you define big T versus little t and the differentiation of that?
Yeah, I think so. Like if anyone, you know, goes on, depending on what careers they go on to, or even if not, if you're just interested in just popping open, Googling DSM and looking up some of the traumatic disorders in the DSM, so like PTSD is one of the more common ones. And we'll think of things in there, like whether it's like witnessing somebody getting murdered, or someone getting hit in front of us, or us being, you know, hit or sexually assaulted. Those are going to be like some of the things that are like the big T stuff, or being in like a really bad car accident, or surviving like a 9/11. I mean, maybe there'll be some trauma from this pandemic as well, I'm sure. I think little T trauma is more, I think, the way I think of it, and you can help me out too, Candice, if you think of it differently. They're more developmental traumas. So attachment to me is like, generally I think of it as like little T trauma, but it could consider to be maybe arguably be a big T. So that's stuff where, a child, a baby has like these emotional needs, and you maybe the parent sometimes meeting them and sometimes not meeting them, or just not meeting them at all, or maybe there is abuse going on around them, and then so these are things that then the person takes into adulthood, into their relationships and things like that. And little T traumas also, which again, arguably, I think that some of this stuff, it's very much, you want to like give the power to the person who's went through the experience. So these are like definitions. I think of like, as a person of color, I think of like, like gaslighting and racial microaggressions, or if we've got like queer students, or people that belong to, or women, people that belong to different marginalized groups, or it's lower social economic statuses, where we understand, or immigration status, where we understand that there's been certain ways in which the world is set up. It's different from how from the dominant group, and those are going to cause these kind of everyday types of traumas of how we're living and moving through the world as well.
Mm-hmm. Yeah, and you mentioned intersections of trauma, and I think that can be applied also to intersectionality around addiction as well. And so I appreciate you bringing that point up. I think it's really important. And finally, Ajay, would you mind saying a little bit about, can you talk to us about some of your own experiences with addictions?
Yeah. Yeah, I'd be glad to. So it's actually a big part of the reason how I got into the helping fields. I'm a sober person. I've been sober since 2007. It's how I moved out to the Midwest originally. And as far as like drugs of choice and stuff, when I was using, I was more of an upper person. I did like cocaine and Adderall, certainly weed and alcohol, and some painkillers too. That's all the stuff that brought me to treatment. And then I think my understanding of addiction now, I do really consider it almost like this hyper focused thing. Someone had given this definition before. It's like, being hyper focused on self, but in a way that's like really cool. Like, it's almost like a caricature. It's a superpower, but it's like being turned in and used in a negative way. So it's in sobriety. Like I've had, cigarettes and stuff. I smoked like a pack and a half a day for years. And then earlier on, when I went through my first breakup, I slept with sex workers for like a year. That was another thing. And then I think even after that, I've had this sort of with relationship styles. I think that's been a big thing, having had a lot of kind of attachment kind of difficulties growing up. I've had this almost like invasive attachment seeking behavior, which could be seen as like an addiction in relationships that shows up, which then can translate into like, could have translated into like dating apps or just this or that. And I don't want to stigmatize myself either as I'm saying this, because all those things are healthy, and I've had ways to like have this healthy. I could say caffeine has been it too. And for me, whenever whatever thing is, it's when I this is how I would define it, because I think it's interesting when you ask the help for the question, because it also shows how I feel about other people then when they talk about their addictions. And for me, it should always be defined by the person. And we had talked kind of briefly before this around that, where it's like, how does the person define it? Is it something that they feel like is causing a problem in their life? You know, something that they can't stop or want to change, or I think some of the like really stereotypical things around alcohol would be like, are you hiding like alcohol in your toilet bowl tank, kind of thing, or here and there. So I'd say things like that. Is it really causing a lot of shame behind it? Is it very distracting to like a person's responsibilities, that making them out of character from their regular self, their bank account? Are they homeless? Like, and is it stuff that's bothering them? So there's a lot of things, and I'd say the big thing is like I want to like normalize addiction, that we all have them. If we want to use that term, we could also say that humans have different degrees of things, but I think normalizing it is a really important thing, and at the same time realizing it is a disease. But if we can understand it in our own lives a bit more and how it shows up, regardless of how what it's like, it could also be saving money. It could be like, I'm that good at saving money, I'm that much of a pinch penny. That could turn into this sort of an addictive type behavior as well. But I think the more we do that, we can just help relate to like each other and other people, especially if we're going to be in helping fields, but people in our lives. I mean, the chances are, aside from us all having those in different forms, we're going to have people in our own lives that we know, or you already know, that are
Mm-hmm.
affected by some addictions that have really been hard for them.
Mm-hmm. Well, first off, I just want to say congratulations on your sobriety of over 10 years. And then also, thank you for speaking to just the complexity of addictions. We talk about in class how, it's not as simple as, just wanting to give it up and getting on that 12-step program. It's really difficult. And so, and adding also to that with kind of the normalization, how that can be useful, especially in people's lives who, maybe someone can't relate to the lived experience of someone with a full-blown substance use disorder, but they can certainly see these ritualistic behaviors showing up in their own lives. So I really appreciate you speaking to that. And just one last question, Ajay, what would you recommend to beginning helping professionals who are going to be out there in the world and, encountering different arenas of addiction, whether it's on an individual level or a group level? Like, what would you say is important for those beginning helping professionals as they work with people who have experiences of addiction?
Yeah, I would say, I mean, I think that's a really big question. I think it's a great question too. I think there's a couple of things people can do. One is this kind of idea of these exercises of being self-reflective of how it shows up in our own lives, is one thing. Another thing we actually did in our trauma course that we had, which for me, I'd already been exposed to, but I think it was a great experience for others, is to go to like 12-step groups, like have that experience to see what it's like in the meetings. Like, so whether it's Al-Anon, which people aren't familiar, that's for people that have been affected by other people's alcohol or drug use or things, or for people that struggle with codependency. So anyone's really welcome there to kind of get a feel of what it's like that kind of a really deep human level. I would say reading some books on those topics. Similarly, I think of like codependency, like Codependent No More or whatnot, and being patient. I mean, if you're not going to specialize in addiction, I would say just being a patient. And I think the thing that I've seen now that I'm almost kind of towards the back end of my clinical year, I've got a lot of cohort mates that were in the clinic there. We were physically in the clinic at Stout. And, if they don't have that background and we work with a client like that, they get triggered kind of around certain things, and so just knowing that you're probably going to get triggered, whereas for me, like, I don't, because I have the background around it and there's a lot of like understanding, and I certainly get triggered around lots of stuff. That's just not in the area that I do. So just realizing that, I think there's just probably a lot of understanding to be had, and just trying to become aware of your own biases. Like we think of like implicit biases, there's like the IAT stuff. know if it's come up in this class at all, but that's something, a great tool. And I think like anything in life, we all have biases, and just trying to be aware of how they show up is going to be the biggest thing we can do to help anyone.
Mhm. Absolutely. Thank you so much for your time today, Ajay. Thank you for sharing your experiences and your words of wisdom on addiction.
I'm glad to, Candice. Thank you for having me, and anytime. Yeah.
Thank you.